right after October 7th, the CJN really had a challenge of how we were going to cover what we knew was going to be the most important story, likely of our journalistic careers. And we think about, what are the stories that we uniquely can tell? We have strong and deep ties and relationships in the community. We can go to the same event that everyone else, all the mainstream media will cover, but we will cover it differently. We'll cover it smarter because we have an understanding of the context and the nuance of the communities that we've worked in. My name is Lila Sarek, and I'm the news editor at the Canadian Jewish News. The CJN wants to continue to cover important stories across the country and important stories in Israel as well. And we can only do it with your help. Visit thecjn.ca/donate to support our work. And if you live in Canada, you will also receive a Canadian tax receipt. Thank you.
The Prime Minister describing this as reprehensible.
That's some of the news coverage from February of this year of a pro-Palestinian protest outside Toronto's Mount Sinai Hospital. You may remember seeing images of a man who climbed the scaffolding outside the hospital's main entrance and then stood waving a life-size Palestinian flag while marchers chanted below. While the protesters insist they didn't block the entrance, which would be illegal, and insist they weren't being anti-Semitic, the neighborhood is home to several other public hospitals, but the protesters targeted the only building with the Jewish name and Star of David in its logo, a hospital founded a century ago by the Jewish community when Jewish doctors couldn't get jobs elsewhere because of anti-Semitism. And although the protesters couldn't have known it, today, Mount Sinai officials tell me 96% of its medical staff are not Jewish. Now, the incident of anti-Semitism is just one of many in an explosion of anti-Jewish and anti-Israel hate in Canada since October 7th, which is also impacting Canadian Jews in the medical profession, a place where for generations Jews have found meaningful careers. But now a new association founded by Jewish doctors in Ontario says the medical school lecture halls where they teach and the corridors of their hospitals and health clinics are no longer welcoming for Jews. A new study by the self-described Zionist organization called the Jewish Medical Association of Ontario says 80% of the doctors they surveyed in the province have faced anti-Semitism at work, and it's made about 30% of them, or 153 to be specific, consider leaving Ontario.
There are already people who have taken those steps because they can't anymore. They just can't walk into a classroom and know that there are students who hate them. They don't want to deal with the end of rotation or end of lecture feedback that just says they're a Zionist, they're evil, or, they were fine, but they're a Jew.
I'm Ellin Bessner, and this is what Jewish Canada sounds like for Monday, December 16th, 2024. Welcome to the CJN Daily, a podcast of the Canadian Jewish News, and sponsored in part by the Ira Gluskin and Maxine Granovsky-Gluskin Charitable Foundation.
My name is Michael Freeman. I am the director of the Canadian Jewish News Podcast Network. When we first started podcasting at the Canadian Jewish News, we had to use the boardroom, and there was this wall of huge hardcover tomes filled with back issues of the CJN print edition, the old weekly paper dating back to the 60s and 70s. And because our microphone setup was not what you would call professional, my co-host and I had to prop up our microphones on these giant books, these tomes. We were literally recording on top of history. Today, the CJN Podcast Network has around a dozen shows. We're at 2 million downloads all time. Like everything we produce at the CJN, our podcasts are totally free. There's no paywall. You can listen to everything for free forever. But we do rely on the community to keep us going. And you can help. Please visit thecjn.ca/donate to make a tax-deductible donation.
The Jewish Medical Association of Ontario went public recently with some of their survey's findings at a media conference at Ontario's legislature. They won't release the actual survey data to the public yet. it might be part of an academic research paper in the future. Nevertheless, what we do know is the Jewish Doctors Group says it sent out questionnaires to nearly 2,000 Jewish physicians and medical students across the country. 944 filled it out fully, and of those, slightly more than half were based in Ontario. And what struck the researchers more than the data, which was bad enough, they say, were the hundreds of heartfelt replies of people's lived experiences in the trenches day to day. Some felt hurt by vocal anti-Israel positions that some of their colleagues have taken, and their healthcare unions too. Also concerning is pro-Israel doctors have been targeted or doxxed by anonymous hackers who sent floods of bogus complaints about them to their College of Physicians and Surgeons, and that required paying lawyers to defend their reputations. Antisemitism, the survey found, is worse at the universities, but also bad in the hospitals. To find out more, I'm joined by some of the founders of the Jewish Medical Association of Ontario. They're all physicians in Toronto, and they asked me not to identify the hospitals they work in, which is telling in itself. So we're joined by the president, Dr. Lisa Salomon, by the chair, Dr. Ayelet Kuper, and by Dr. Barry Pakes and Dr. Karen Devon. Welcome to the CJN Daily, everyone.
Hi, Ellen.
Hello. Hi, thanks for having us.
I'm interested in the decision, first of all, to the scope, when it was done, which agency. Maybe you can start by sort of these factoids a little bit about the commissioning of it and that sort of thing.
There's no question, we all know, and that's one of the reasons why the Jewish Medical Association of Ontario was created, along with many other organizations in Canada, because we know anti-Semitism has worsened very significantly since October 7th. All of us know that anecdotally, all of us know that personally and from colleagues and friends and from looking at the internet. But what we didn't know is to what degree, and more importantly, we didn't have data that was really reliable, that was very robust from around Canada, Ontario, and many different centers, and we weren't able to take different pieces of data and compare them in order to understand what is anti-Semitism really looking like, with a view to creating ways of combating it and advocacy and helping, people across institutions, government, and the public understand to what degree anti-Semitism is going on. So that's really was the impetus for the study, and then launched it in September for physicians. And there's a survey for healthcare professionals other than physicians that's ongoing.
So, Ellen, when we came up with the results that we had, which we were expecting things to be bad, but the results we got shocked even us. But really, we started this as a way to figure out what our members are going through and what they need us to do for them.
There are many things in the survey that we actually haven't shared yet. We're sort of, working out how to share that. The first most important finding is that such a huge proportion of Jewish physicians and medical learners answered the survey. So physicians are not the best survey answers in the world, and people are all busy, physicians or other professionals. But the fact that 1,000 physicians in Canada out of only probably a couple thousand, maybe 3,000 or so Jewish physicians in Canada, a third of them responded, is incredible. Number one. Number two, what we have as well is incredible stories and anecdotes from those individuals, and that's what Ayelet was referring to. Is the most disturbing part is when you read what people who otherwise were not expecting to be treated in this way, based on their many decades or however long they've been in medicine. It really is heart-wrenching to read it. And over 500 of the respondents actually contributed either one or many sort of anecdotes about what had happened to them post October 7th, or a variety of other things that they shared.
And I think it's been very useful to get some of the qualitative data, because we're always told, oh, you're just making this up to oppress people. You're just making this up that it's really people advocating for human rights in Palestine. We get told all sorts of things about what we're really experiencing. So, what the kinds of things that have come up in our data, people saying, you're not like the other Jews I know. I'm reading to you now from our data. You're not like the other Jews I know. You're not sneaky. We have another person who said, I've been told all Jews are liars. I've been assumed to be money hungry or cheap. I've been blamed for all sorts of things. I've been felt for horns. And, that one really grabbed me, because as some of the other people on this call know, I've been felt for horns in the hospital. And yeah, Ellen, you too?
My roommate in
And
university asked me the first day I met her, and that was 100 years ago, where's your horns? But, you
and
know,
these are things that are happening today. These are people's descriptions of things that have happened to them since October 7th.
because we're talking about university settings, teaching hospitals or teaching, how much of what you found is because it's in academia versus specific to being a physician? We know campuses are hotbeds of DEI and oppression talk and anti-Semitism. Is there anything special about the medical thing?
Absolutely, Ellen. So we do know that after October 7th, we definitely still have people who are experiencing anti-Semitism in hospital practice settings. For example, in Ontario, about 24%, 25% of doctors experience anti-Semitism in the hospital. Similarly, we can see that in Ontario, about 15% experience it in medical administration or leadership settings. Also, something that is affecting our learners who are in the hospital and in the academic setting, very much something that's affecting our learners. And that's something we're really worried about.
Okay, let's dive into that. Anybody want to explain how it looks for Jewish medical students and Jewish residents and interns? And
well, what we've heard from them is that they're really scared about their futures. What we've heard from them is that they're worried about their ability to be able to continue in their careers. Now, it's one thing for folks like most of us who are well established in our careers, and taking something away from us is harder. But for our learners, we have, in Ontario, 67% of our learners are worried about the future of their careers as Jews, that their careers will be impacted because of their Jewishness. And so we see these learners who are trying to decide if they cleanse their CVs of anything Jewish they've done. Should they use their middle name? Maybe they have a less Jewish middle name. Should they use a different parent's last name? Should they take off the high school they went to? Should they take off the clubs they belong to? And so those are the kinds of concerns that our learners are coming to us with. And of course, they're also experiencing significant anti-Semitism in their day-to-day. Most of their time is spent in the university setting. So they're in the place that has the most of it, but they're more specifically also concerned about what this means for their futures in a way that we are less worried about day to day because we're not applying for a residency position.
I mean, I have a very specific personal experience with that as I was organizing a faculty session on anti-Semitism before October 7th, and a resident did most of the work on that session. And then when we did the session, it was actually, I think, November of 2023, and that same learner asked to be, they were happy for the session to occur, and that they had contributed, but they asked to not be acknowledged, to not have their name associated because they were currently applying for jobs.
There was lots of anti-Semitism in medicine before October 7th. As you said, I've been doing work on this area for years. The paper I wrote was written long before October 7th, and we were having the same issue, Jews are the oppressors, long before October 7th. It's just given people permission to yell it from the rooftops, to say it with impunity, and then to turn around and say, oh, I'm not really anti-Semitic.
what definition of anti-Semitism was there in the survey, or did you not have one?
So the survey was really about people's experience of anti-Semitism. So whatever people felt was anti-Semitic towards them, however they experienced it, was, we gave them free rein. We certainly didn't describe it.
I think to your point, what's been really upsetting throughout this whole time is having non-Jewish colleagues defining what is anti-Semitism, what's anti-Semitic to us or not, dismissing our concerns. And even after, some of the articles have come out since our launch, seeing non-Jewish colleagues and physicians on different social media platforms dismissing our concerns, pretending to understand or making all these assumptions about who was surveyed, what definition was used. all sorts of things. And, no other minority group do others outside of their group define what is racist towards them. And it's shocking to me and quite upsetting, frankly, that Jews are treated completely different, and what we feel and as anti-Semitism, as discrimination, as harassment towards us, others dismiss and tell us that we're wrong.
Everybody's in this boat, but doctors and Jewish doctors have a cachet historically, a revered place in society that even people who are not in the Jewish world have high regard over the generations for Jewish physicians. So when you say this, what do you hope people will take away from this?
Ellen, I think there are a lot of people out there who, at least I hope there are a lot of people out there who don't hate Jews. I think there are some who do. I think they're making our lives pretty miserable. And I think they're maybe scaring, silencing lots of other people who are our friends or who are neutral about the whole thing. Or like, I don't want to get involved. And at a certain point, if they don't get involved, at a certain point, the Jewish community will no longer be able to look out for ourselves, will no longer be able to take care of ourselves. I don't think we're at that point now. Right now, we're still at the point where we're advocating for ourselves. We're trying to say, help us, help you, help us stay help us stay here and be your doctors. Help us stay part of keeping Ontario's healthcare system strong and looking after every single patient, looking after every patient who needs us. But at a certain point, if our allies, our friends, the neutral people don't stand up and say, enough is enough, stop it. Stop being anti-Semitic, stop treating Jewish doctors and Jewish patients and all the other Jewish healthcare workers and Jewish learners and the Jewish university students who then need to come through the medical system and everybody else in our community. Stop treating them so badly. At a certain point, if they don't stand up and help us, we're not going to be able to manage this on our own. And maybe seeing that this isn't just something that affects a few Jews here or there, maybe it's something that they actually have to take seriously. If people actually care about the thousands of Jewish doctors, learners, and other healthcare workers in Ontario being able to work, being able to keep up their best selves, being able to bring their whole selves to work, which we know helps people provide better care, stay psychologically safe, work better in teams, do all the things that we know as doctors are required for good quality medical care. We won't be able to do this alone forever.
What does that mean? You won't be able to do it alone? This is the second part where you said you're going to leave the profession.
Well, I'm not saying we're leaving. I'm saying I don't think we'll be able to fight anti-Semitism alone. We're fighting it alone right now. We've got a few brave allies who stand up and say, this isn't right. But usually they say it to us quietly. Usually they say it in my ear. Usually they say it, well, can't say it out loud. Because if I say it out loud, someone's going to get mad at me. Or if I say it out loud, I have to do it in an all lives matter kind of way. I can't speak for the Jews. Or they'll dox me too. They'll harass me too. I'll end up in your shoes. I actually had a non-Jewish colleague who tried to stand up for Jews. And they got so doxed and harassed that they had to just go silent.
Let's talk about that. What does this look like? We've heard about it. Doctors have been safety plans. They have to go to work. They have to take their social media accounts down, complaints to the human resources departments.
All those people many people got doxxed and everyone's scared. Those people who got doxxed, many shut down their social media accounts or they just stopped talking. And those who hadn't been targeted just stopped talking for fear that they would be next. So it's still happening.
The implied result of this is that many Jewish doctors will look elsewhere, or students will look elsewhere, or try to look elsewhere to get work. How realistic is that? Where are they going to go?
Well, I think there's two parts.
Or they're just going to retire.
it's not worth it for them to do it anymore. Most doctors teach because they believe in it and they love it and because they want to pass things on to the next generation of learners. And it's not worth it for them anymore. But in terms of leaving, I think it's twofold. I don't think there's many people who are thinking, wow, there are some fabulous options and I'm going to go for this great job somewhere else. It's that people just aren't sure how much longer they or their families or their kids are going to be safe, are going to have jobs where they're not having to keep silent all the time. We have people who said in our data, I'm scared to go to work and let people know I'm Jewish. So if every day you go to work and you're pretending you're not Jewish and you're pretending you're not taking a day off for the Jewish holidays, or you're pretending that you're not celebrating something with your kids, you're having your kids' bar mitzvah, but you're not telling anyone at work because, God forbid, they figure out you're Jewish. At a certain point, you can't keep working in that environment. I don't think we'd expect people in any field to keep working in that environment. So either maybe they find a different hospital, maybe they find a private practice, but at some point, maybe they also look to go elsewhere, and whether that's the United States, whether that's trying to see if there's somewhere better in Canada, whether that's moving to Israel, whether that's going somewhere different.
I mean, I think so. There's the people moving. There's the doctors who are ramping down their teaching, which I think is a really big impact right now because TMU is supposed to be ramping up. They're proposing a medical school at York University, and things are pretty saturated here, so they need teachers. I think it's more important, at least for me personally. Medicine is a wonderful Jewish profession. It's a wonderful profession generally, but it is a way for you to interact with the best of what humanity has to offer, make a big difference in the lives of people. And for us to watch, as people who've been in this profession for a long time, and many of us have kids, I have 3 of which want to go into medicine, for them to watch what's going on, and for people just in undergrad watching very gradually, or in high school gradually watching what's going on. It's horrible. I want to make the next generation will have the same opportunities that we had to be in a profession that's incredibly rewarding. It allows you to send your kids to Jewish school, which is a whole nother thing. But it's just really wonderful. And it would be, there's a long history of medicine and Judaism, certainly. And it's just horrible to think that we're really closing that off. And we're already seeing that, certainly. If you look at Jewish enrollment in medicine significantly decreasing because people are just afraid of it, it's just not worth it. That in and of itself is something I think what we're trying to do is prevent that.
How has your life been impacted personally by the stuff that everybody's now reported to you, but you were living it?
So what I've experienced, I feel like I've experienced an awful lot of what I would think of as secondhand trauma. I've experienced everybody else's pain, and there's a lot of it. Like, my children don't even think it's weird anymore that I'm on the phone and I'm like, I'm so sorry, guys. I need to talk to this doctor. Something bad has happened to them. Because I've got someone crying on the other end of the phone. People want to reach out to us and say, help me, help me, help me. And it's always shocking. And it's always more shocking because people say, if you had asked me a year ago, 2 years ago, I would never have believed that this would be happening to me.
Are you seeing that I've heard that people have said that, but I don't know if that's true, that if it's a Jewish doctor, the patient doesn't want them. Does anyone know that happening?
We certainly have examples in our data of
Dr.
people
Salomon,
saying
you have that?
Yeah, so we did experience that somewhere I work, that a patient had come in and saw the name of a Jewish physician, specifically said that they didn't want to see that physician. And, you asked us just now, how has this all changed us? So, from my perspective, it's like Ayelet shared, it's been very traumatic, a lot of, secondary trauma from people sharing their stories, but even like personally experiencing people that I thought were my friends, that I thought were my allies, that we shared really difficult things over many years, different opportunities, who were always there to support me, and to see that after October 7th, that they're totally turning against Jewish physicians, turning against, who I am. I've always been a proud Jew. I've never hit it. I spoke to everybody about it, speaking about Jewish events, holidays, children's bar mitzvahs, with the schools they went to, wearing, my Magen David. And, the last few months I stopped because just for that fear. Early on, I tried to educate, to explain to my colleagues where I would see them make comments that made me uncomfortable, that was upsetting, that was wrong. And I just felt that at some point it was futile, that they had their opinion, they didn't want to listen. And truthfully, I was worried that they would turn it around. We saw a lot of that. Right? A lot of this doxing is by people spinning, just taking a couple words and totally skewing what it actually meant. And so I think a lot of us have been silenced.
Dr. Devon, did you want to say what it's looked like for you?
I mean, I would describe it as being on shpilkes. Every room you walk into, every conference call, whatever it is, a search committee, you're not sure how people are going to perceive you. And occasionally you feel like you have to bear the weight of 3,000 years of Jewish history and be that, again, like Lisa and others here, I am proud as well. But I've never felt like I had to be so, concerned about what environment I might be up against on any given moment or day.
And that's what Jewish Canada sounds like for this episode of the CJN Daily. Our podcast is made possible thanks to the generous support of the Ira Gluskin and Maxine Granovsky-Gluskin Charitable Foundation. It's interesting that these Canadian findings seem much worse than a similar study that came out a few days afterwards in the United States. That one was carried out for Stand With Us, and they found only 40% of the doctors surveyed said they'd witnessed or been the target of anti-Semitism. Our show is produced by Zachary Judah Kaufman. Our executive producer is Michael Freeman, and our music is by Dov Beck-Levine. Thanks for listening.
I recently wrote a story about the editorial landscape of campus newspapers, how many student newspapers throughout the country are rejecting pro-Israel perspectives. It also focuses on what students are doing about it. This was an important story that I think highlights the cultural war that's taking place on campuses right now as students continue to adopt an anti-Israel and, in some cases, anti-Jewish perspective. My career as a journalist actually started at a student newspaper years ago, so this was a full circle moment that's allowed me to revisit my roots and see how much has changed in a post-October 7th world. My name is Mitchell Konski. I cover campus life and education for the Canadian Jewish News. If you want to support this work and everything else that we do at the CJN, please visit thecjn.ca/donate. And if you're Canadian, you can also get a tax receipt